Good afternoon, everyone. Thank you very much, Director of Ceremonies. My task is a small but very important one to make us all understand why we are gathered here this afternoon. I should think by now we are all now aware that since January 30, 2020, we had this outbreak, the COVID-19 outbreak, declared a public health emergency of international concern. And this effectively meant that our World Health Organization has taken charge of the coordination of the preparedness and the response to the outbreak. In that regard, we have a few fundamental elements here that have been recommended for us as different countries to adopt as we prepare for the response to the current outbreak. These elements are, number one, we have the emergency response mechanisms. Countries also need to ensure there is risk communication and public engagement. We are also determined to get our case finding and contact tracing processes in place and in good order. Public health measures such as hand hygiene, respiratory etiquette, and social distancing are also key. In addition, we need to have our laboratory testing services available and in good order for us to get to diagnose all the cases that have coronavirus early. Another fundamental element is to treat patients and hospital readiness, infection prevention and control, as well as an all of society, all government approach that we are recommended to adopt as countries. And we have done basically that as the country. This meeting, therefore, offers us the opportunity for us as Ministry of Health and our stakeholders to update yourselves on the progress that we have made so far regarding this response. This is a collaborative effort. However, the Ministry is taking lead of that process of the preparedness and response. We note and we acknowledge that we may be having, and of course, let me not say we do have some blind spots. And without you saying to us, here are your blind spots, we will find ourselves implementing a non-efficient response. And that is the least we wish for. Hence the reason why we have gathered you today here. There is need to fight against misinformation, different allegations from different signal points. We are here obliged to give you information and accurate, precise information, as you are our making. As we consider you, the middlemen, you are our link between the public and ourselves. We have COVID, the virus, as a threat to us, and you need to be communicating that to our public. And we also need yourselves to be with us as you pass the message to the public on how they can prevent the infection of the COVID virus. In addition, we need you to take our mitigation factors to the public. You are indeed our fourth estate, and we trust you will do so as you have always done that. So we are basically here for that sole purpose that we are here. Let's join our hands. Let us share with you what we have done and what we haven't done, and you also give us the feedback and you get to take that to our communities and the world at large as a feedback to the entire world of what our country is doing. We are here as a country and we need to have our public health security at the utmost we can manage to do. Thank you very much. You are very much welcome to this meeting.
Distinguished guests, ladies and gentlemen, the boss estates, good afternoon. I'm just here to just give you a brief and an update as to the response of COVID-19 virus, which started late December in Wuhan, China. I believe this is the second press conference that we have had, and this subsequent one is an update of what have we done to date with regards to the response. And one thing that I can say is our message and our response has been centered around three key issues. One is prevention. Two, in the event that we have a case, is containing the spread of the disease. And three, is managing those cases that need management. And it's important that your stuff is okay. All right. It's important that we are on the same page on this thing, because you can carry the message across to the rest of the nation in this COVID response. Now, the key elements of our response are centered around coordination, laboratory support, case management, risk communication and community engagement, infection control, and logistics. Earlier on, when we started with coronavirus response, we activated the Emergency Operations Center. And this Emergency Operations Center is the nerve center of the coordination in this country, and is currently domiciled in the Ministry of Health and Wellness in room 102. This allows the public to, call in and get more information about coronavirus. More importantly, for those that are affected by the disease, it allows them to seek guidance as to what to do, regarding where to go, how to deal with being potentially exposed to the disease. There is a team that actually meets on a daily basis and decide and collect, gather reports, and also give reports to the nation as to the situation in Botswana. So on a daily basis, we have a situation report that is given out that articulates the global situation as well as the situation in Botswana. And the other thing is we activated those district commissioners around the country, the rapid response team. This was subsequently, there was training, an update, upskilling training on the COVID virus, and how to manage, how to respond, case management, and so on and so forth. And all these teams were trained across the country by various teams within the Ministry of Health and Wellness. And to date, more than 1,000 people have been trained in the COVID response. And they are the ones who are responsible for managing cases or dealing with cases at our respective districts. On the laboratory support, a lot has been said about our inability to test the virus locally. Initially, as you may know, we've been using the National Institute for Communicable Disease lab in Republic of South Africa, which is one of the 2 WHO certified labs in the continent. Another one being in Senegal. We have done a significant amount of groundwork in testing for the disease locally. We have acquired test kits. We're going to use our existing testing platforms, being PCR machines, to test locally. And we expect that to commence this coming week. That will allow us to really step out our efforts, being able to identify cases quickly and separate them from the rest of those who are not sick. So I believe that's a step in the right direction. And we hope in the near future we will have rapid kits, rapid testing kits that will allow us to even test at the clinic level, facility level, so that you can quickly segregate patients and isolate patients and avoid community spread. On issues of case management, we initially, as you may know, started screening at port of entry. And the initial thrust was on major ports of entry. That we articulated earlier on. Typical ones will be of the Web, Pioneer, Makarama, Martin Street, and so on, and all the way to Kasani, and a lot has been done in terms of screening, and a lot still needs to be done in terms of screening. We take note there are areas that we still haven't covered. We are working around the clock to increase the number of people or hotel staff to cover some of the remaining areas. And we are also, as noted by Mama Jimmy, we are embarking on a whole of society type of response, so that where as a nation we are making, or as a ministry, or as part of the response team we are making, some of this can be covered by other areas or other stakeholders in society. So to date, we have screened more than 200,000 international travelers, and we have had around 16 suspects. 14 of those have been tested, and all of them have come up negative. Currently, there are 2 suspects that are under our observation, and tests are ongoing. And as earlier mentioned, we are continuing to train stakeholders. We are continuing to train stakeholders, professionals on the COVID response. So, with regards to risk communications and community engagement, I believe all of you can attest that the team has been all out in social media, or in all forms of media, radio, TV, social media, and print, to bring the message about COVID-19 to the nation. And a lot has been done. We have printed materials on COVID-19, and a lot needs to be done in terms of dissemination, so that it can reach those who are in the far-flung areas in Botswana. With regards to infection control, this is one of the key components of COVID-19 response and prevention. We have noted challenges in this area, and work is still being done with regards to stepping up our infection control efforts in our hospitals. We don't want to spread unintentionally diseases in our facilities, and infection control and prevention, starting with the frontline workers and all the way to the community. With regards to logistics, the COVID-19 virus started when most of the industries were in recess. And you may know that in China, during this time period, between January and February, is the lunar year. And most of the factories were closed. More importantly, they were on holiday, and as a result, more importantly, they also had the outbreak happened in their region. That put a lot of strain in the existing supplies, especially in personal protective clothing. And when we started the response, one of the key areas was dealing with supply of commodities for the COVID response. Initially, despite us having the resources to acquire, the supply has not been adequate in terms of the numbers that we wanted. However, we have leveraged on our partners to ensure that we augment the existing supply so that we can sustain the response over a period of time. And work is still ongoing to ensure that people who are in the front line are protected in terms of the requisite commodities for fighting coronavirus. After having said all these things, there are still gaps in the response. We take note, and this is from the feedback that we have received so far from the community. One of the gaps is this concern that not all the ports are covered, or ports of entry are covered. And we have taken note of that, and we are working on ensuring that we will use the whole of government approach to ensure that everything is covered, and more importantly, increase or improve the number of staff at our ports of entry. We also take note that as much as we have done well in terms of information, printing and everything, that information needs to be taken to the community, needs to be understood by the community. Everyone needs to understand what is a quarantine versus isolation, because a quarantine is somebody who is suspected to have been exposed but not sick, and is separating himself from the rest of the community. And an isolation is when you are having symptoms and you don't want to spread those symptoms from one person to another. So those little things are the ones that, as a team, as a response team, we need to go out there and disseminate to the community. And we need to leverage on the technology that we have in terms of information dissemination, either through YouTube, social media, and so on and so forth. And also leverage on the talent that we have in this country to carry out that message to the rest of the community. The other issue that we also noted is, as much as we have done in terms of the preventive messaging and so on and so forth, a lot more work needs to be done at our facility levels so that everyone understands what they're supposed to do. And we don't run a risk of patients who are potentially sick being coming to our facility. It should be noted that this disease affects people, or mortality increases with increasing age. So, you from 0 to 40 years is around 0.2, and it starts to decline as you move from 40 to 50, 50 to 60, and all the way to beyond 80 is around 14%. And current crude mortality rates are 3.4%. So it's important that we take note that our facilities are full of people who are elderly, who are sick, have comorbidities. So the key element of the prevention aspect of it is ensuring that the frontline workers, the hospital workers, are aware of what they're supposed to do in terms of the disease prevention and COVID response. Hence, a lot more work needs to be done at our facility level. And also, it appears that we haven't really addressed the question of what if we have the actual disease or actual person with a confirmed case in this country. So we'll be working on that so that the message is clear, the message is simple, and we don't confuse the rest of the nation. One of the things also that we need to take note is that the situation on COVID is fluid, and things change with time, especially with regards to travel. It should be noted that WHO has not imposed any travel restriction on COVID-19. However, countries have taken lead in assessing situations individually at their own respective countries. So, and even as a country in Botswana, we are working on that. And I think recently we put out a communication which somewhat brought, although it was a letter, it brought a bit of confusion, mainly because of the simplistic nature. However, we are working on ensuring that our message is clear and concise, and everyone is understood by everyone. So, at the end of the day, one thing that I can tell you is that COVID-19 is not a Ministry of Health issue, it's not a WHO issue, it's a national issue that calls for each and every one of us to take that responsibility and spread the message. And more importantly, the prevention of this disease starts with you. And I would like to say that we are concerned about the level of misinformation sometimes that happen in our social media. Nowadays, everyone is an expert in media relations and media what. However, kindly note that this is a serious problem or potentially a serious issue with both health and economic implications. So our urge that we guard our tongues and guard our message, we don't misinform the nation, and I believe as a nation we can defeat this potential threat to our country. With those few remarks, thank you very much for the opportunity to brief you, and thank you for coming to this meeting. Thank you.
First and foremost, I would like to thank you for this opportunity to do a briefing on coronavirus, and to thank you, members of the press, for the good work that you have been doing to make sure that most of the communities are aware of what is happening. Every single day, I've been listening to what is being discussed on Corona, both on radio and on TV. And I really would like to appreciate, although sometimes I don't understand the language, but I hear COVID-19, and I'm happy that you are keeping the fire burning. And to really thank the Ministry of Health for all the effort and the preparations that have gone into the preparations that we have been discussing with them almost on a daily basis. As the director said a few minutes ago, the situation is quite fluid, and we still don't know so much information, and therefore, because of the information as it comes in, we try to update the Ministry of Health, and sometimes this information comes in on a daily basis. So I'm quite really grateful for the team and the dynamism of trying to get all the recommendations of WHO implemented, sometimes on a weekly basis. So having said that, my task is really to give you a picture of where we are globally, and perhaps also in the African region. And globally, we now have about 113,000 cases, which are actually confirmed. And of those, 4,000 have actually died. 80,000 of the 113,000 are from China, and 3,100 deaths in China. Outside China, it's about 32,700 cases, and 872 deaths, with 109 countries or territories that are now affected. 5 of them were new in the last 24 hours. Now, coming to the African region, we now have a total of 39 cases in the countries of DRC, Algeria, South Africa, Senegal, Cameroon, Nigeria, Burkina Faso, Togo. And most of these, they got their infection from France or Italy. Those are the 2 main sources. And those that are in the East Mediterranean region, which is the Middle East, they include Egypt, Morocco, and Tunisia, but they are part of the African continent. And so far, now they have 66 cases, with Egypt having about 59, and Tunisia has 5, and Morocco has 2. So that is basically the situation in the whole of Africa. And therefore, it brings a lot of concern, especially if most of the cases are really being coming from Europe. And really, countries are now expected to take some actions as to prevent infection coming into their own countries. Then I wanted to speak briefly of what we know about the transmission of the disease. I think as information becomes more clearer, it's important to know that we have now the incubation period to be about 1 to 12.5 days. And what do I mean by that? If you are exposed to an infection, it will take you anywhere between 1 day and 12.5 days to start getting the symptoms. And therefore, it becomes really important that we are more vigilant in trying to make sure that those who are exposed are aware of that. The other important thing which we have now more information on is how long people are supposed to remain classified as cases or as being sick with COVID. The guidance now is that when the clinical symptoms disappear, there must be a repeated test, and if that test is negative on 2 consecutive times with at least 24 hours in between, the person can be certified as free of coronavirus. The other important thing is, I think, what was alluded to by the director, the age groups that are really affected. For some reasons, the children under 10 years are not getting this infection as you would expect. But the ones more affected are in the older age groups, and it becomes really severe when when you are much older or when you have comorbidities with comorbidity. Okay, if you have another underlying sickness like diabetes, hypertension, if you are immunocompromised, you would have a more severe disease. And therefore, those are the ones that are likely to die. And we've done a lot of studies in Korea, South Korea, and also in China. The other important issue is about case management. As of now, our guidelines are still recommending supportive treatment, which means you treat the symptoms you see in isolation. We still are carrying out clinical trials for different medications. So as of now, there is nothing that we can confirm, and we have about 20 vaccines that are still being experimented, and we are hoping in a few weeks some of those will start clinical trials, but there is nothing on that at the moment confirmed for that management. In terms of lab diagnosis, and as the director said, the effort of WHO is to make sure that every country is able to diagnose the disease in country before referral to specialized labs. And for that, most of the countries are now being either in the process of training, or some have already been certified, and on the African continent, 34 of the countries have this capacity, and we are hoping that Botswana, by the end of this week or thereabout, they'll be able to join that group. The surveillance guidelines have now been extended, not only for just the points of entry, but from the WHO perspective now, even all the health workers need to know the case definition and try to make sure that anyone suspected of COVID is isolated until a proper diagnosis is done on them. So surveillance will continue, which is basically trying to track anyone who may have the disease. And therefore, that's where you come in more strongly, because you keep that awareness that people with certain symptoms of this disease need to go to certain places where they can be investigated for the diseases. The other important issue is on the logistics, where we are talking about the personal protective equipment. We are globally, because of the rush for so many people trying to look for these masks and so on, we are having an acute shortage. But we have reserved something for the countries that have diseases, and those countries, we are able to supply them with the requirements as and when they need. Because Botswana is one of the countries still with no case, what we are stressing is that as of now, most of they should just continue with being more prepared for a case should it come. And related to that preparedness, we would like the communities to also prepare at their level with their understanding how they can protect the members of the community should a case happen in that community. I think those are some of the updates I wanted to give from the WHO perspective. And maybe because there are so many rumors going around about South Africa, I want to confirm that as of 6 a.m. this morning, the number of cases confirmed are 7 in South Africa, not 10 or 13, they are 7 as of today, 6 a.m. So I think the numbers 10 or 13 are people who are suspected and they are still waiting for confirmatory tests, but the confirmed are 7. Thank you very much.
Yeah.
Thank you, Dr. Ladies and gentlemen, my short presentation was a rather update in terms of where we are as an industry, where we think we are going or not going, what are the risks, and the state of preparedness with regards to this epidemic that hasn't got a cure as we speak. What are we going to do if this happens, that doesn't happen, and so on and so forth. First and foremost, let me just start by saying tourism is intertwined with travel. You can't separate the two. Therefore, we are affected also by what the aviation industry, the airline industry, the decisions that they make on a daily basis. And I would just like to quote from the International Air Travel Association website. There are ongoing updates in terms of communication with the general public globally. And it says coronavirus and air transport. IATA, that's the International Air Travel Association, is closely monitoring developments related to the coronavirus outbreak and is actively engaged with the World Health Organization, WHO, ICAO, and the US Centers for Disease Control. WHO is advising measures to limit the risk of export or import of the disease, but continues to advise against the application of travel or trade restrictions to countries experiencing COVID-19 outbreaks. Like has already been said, that is the global advice from your WHOs, WTOs, but individual countries often have to make their own decisions based on assessment of their own risks. In terms of WHO and UNWTO, there's a few guidelines that I would like to speak to. It says the outbreak of COVID-19 presents the tourism sector with a major and evolving challenge. The UNWTO is in permanent contact with the WTO, World Health Organization, to ensure an authoritative voice and responses for global tourism. The UNWTO therefore calls upon the sector and travelers to address this challenge with sound justification and proportionate measures. Tourism is currently one of the most affected sectors, and the UNWTO is revising its 2020 forecast globally, aware of the fact that any assessment of the impact of the disease on international tourism is not possible in the current situation. So any estimates that we have globally of the impact of the disease to date is a moving target. It's a moving target. Each time we check, the numbers are going up in terms of how many billions of US dollars is affecting the airline industry as well as the tourism industry. Again, the WTO itself is currently advising against the application of travel or trade restrictions to countries experiencing the COVID-19 outbreaks. So all the world bodies to date are advising against automatic restrictions, but countries, as I said, can make their own assessments and continue to do so. I will now speak to Botswana's tourism as led by our organization in terms of facilitation and tourism awareness, marketing and the like as a government agency. Ladies and gentlemen, you'll be aware that, please excuse me, my papers here, I've got microphones over there. Okay. We are having to have a serious look, and I know that we are saying this in advance of our industry meetings. So the first industry meeting we are going to be having, where we can talk directly with industry, will be this afternoon for Hawaii managers and owners of tourism facilities. And then tomorrow we'll be in Kasani. On Friday we'll be in Maung, and we'll carry on in that manner, so that we have we bring in our partners to be made more aware. As the Minister of Health was saying, this is a global, not just a national, but it's a global, unfortunate, very unfortunate event. And we are all in it. It's not just all of us looking at the Ministry of Health. We need to be aware, we need to support, and we need to speak with one voice. We are currently reviewing in the short to medium term, our international expos and fairs that BTO attends either on its own or quite most of the time we attend with industry. You may be aware that just recently, end of February, beginning of March, the biggest tourism fair in the world, ITB in Berlin, was cancelled last minute. So lessons learned from that, the manner in which it was handled with the cancellation, the effect financially and otherwise, because it's not just financial for now, it's also impacting into the future. Just to share with you, ITB is one of those, in terms of timing, it shows that a lot of tourism that sells in advance and sell packages. We have done deals in the last week for next year already to international buyers. So that didn't happen. So we have to now find options of how do we get into 2021-22 catalogs, because that event didn't happen. But we are looking at lessons learned from that one, force us to look at the short to medium term international expos and fairs. If this COVID-19 does not abate. In that regard, and I will speak out and share with you which shows are coming up that we are all familiar with. We'll talk about the external, and we'll also address the internal events in case the disease does not abate. We will not take any further bookings from Botswana operators for fairs that are happening in the next 5 months. We are not cancelling, but we are not committing. We will watch the situation and we will act responsibly. I'm talking external events in particular. We'll act responsibly and try and minimize any financial last-minute impact by at least making a firm announcement on whether the event is going to happen or not, as a guideline, say 3 weeks before the event. You'll be aware, ladies and gentlemen, to give you an example of the fairs, and before I even call them out, if you call the organizers of these fairs, all of them, because we have, they will tell you they are not cancelling. So did ITV. It wasn't cancelling until 2-3 days before the event. But we all have to act very responsibly in ensuring that as much as we're in business that, yes, benefits its owners, businesses that have a high impact on employment, businesses that have a high impact on national economies, such as Botswana. Nonetheless, people's health comes first. Forthcoming events will be in Durban and Durban, because that takes place on early May. May is around the corner. We've got ILTM, which is a top show in Singapore. That's April. That's also question mark. We will not commit to that. We've got Namibia Tourism Expo that happens in June. We've got We Are Africa Cape Town that happens in May. We've got World Travel Market Cape Town, which is called World Travel Market Africa, that's April. So, although we had opened already and committed to attending these fairs, we are now putting a cautionary. And we want to be very transparent and open about it and make sure that our industry are also aware. So those members of industry have already booked with us, and some have already paid. We are saying, because we haven't closed yet, let's not take any more bookings. We will play it by ear, we'll monitor the situation. If we have to cancel, we'll try by all means to do so 3 weeks before the actual fair itself. But we are now talking and openly saying, that's a cautionary. We can't commit to those. We'll be guided by what actually happens with the development of this epidemic. Coming closer to home, you are aware where there are national events that we also either participate with others, partners in, or do on our own primarily or drive them. We've got a few of them also coming up. Again, same story in terms of what happens, what evolves with this coronavirus. We are also announcing a cautionary. You will be aware, ladies and gentlemen, we published beginning of this year, this calendar year, a Botswana calendar of events. And if you look at April on it, there's quite some big events happening. Some of them we don't have decisions on. All we can do in collaboration with all our other partners nationally and yourselves is to also caution and advise other organizers for it. Be vigilant. Be vigilant, because these are events that get together a lot of people in one place, and sometimes hygiene issues. You need to consider those kind of things, close contacts with people as we celebrate and enjoy these events. But I cannot speak to those except to advise. I can only speak to the ones that are directly under WTO control, depending on, as we monitor the spread of this disease. We have the first one that will be coming up will be Kawajin Challenge and Cultural Festival in May. That's around the corner. Followed by the Toyota Desert Race, the 1,000-kilometer desert race in Silibikikwe that happens in June. And then followed by July, the Makadikadi Epic, which is a skydiving event. I'm only singling out those that are in direct control of WTO and saying we are announcing a cautionary. If we have to, we will cancel it. But we will also try and minimize financial damage and resource damage by giving that early announcement. As you know, we do these events with a lot of stakeholders. We award tenders in advance and so forth. So we've got to manage all that. Even where maybe we are allowing awarding tenders now, they'll be coming out with a cautionary to say you've got the tender, but know that if the situation warrants, it may be cancelled, so that you also shoulder your own liabilities in that regard. As I draw towards the close of my brief, let me also just share that yes, a lot of conferences are being cancelled as we speak, in-country conferences, especially the ones that involve international people coming in. But let's also be cautious, because we still see a lot of our own, normal local conferences. That's fine. But the least we can do as an industry and as the public as well is to apply all their advice that has been given through our Ministry of Health and Wellness over the months. Precautionary measures, preventative measures, the do's and don'ts, because let us not be complacent and say Botswana is safe. Nobody is safe globally, and you watch the news, all of you, you've seen how it can move. You read about one country before you go to bed, when you get up in the morning, the number is doubled or something like that. So I think we should continue to be vigilant, and please also we will need the media's understanding in terms of any precautionary measures that will have to be taken into the future, because it's a moving target. Ministry of Health is advising these. We are advising figures now. By the time we finish this meeting, the figures will have changed. Ladies and gentlemen, I'll say anything else that I may not have covered to the question and answer session. Thank you very much.